Welcome to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And in this case, we're talking about the Mental Health Cooperative. We're honored to be joined by Michael Bjoralt, Program Manager of Emergency Psychiatric Services with the Mental Health Cooperative. How are you doing?
Hey, good morning, Jeremy. Thanks so much for having me.
Absolutely. So when you talk about mental health, we have a lot to unpack and to dive into. Let's start with a little bit of history and context for the organization, though. Give us some history for the Mental Health Cooperative.
Yeah, absolutely. So Mental Health Co-op, they opened back in 1993 and has been a community leader and partner in Nashville since that time. We have expanded our services into multiple cities throughout Tennessee. We are in Knoxville, Chattanooga, Memphis, things of that nature. So we're just kind of expanding and just trying to, leave our blueprint out there for everyone to get the assistance that they need.
When you look at your area of focus, give us a little bit of your background and specialization for Mental Health Co-op.
So what we're doing is we're trying to assist folks who are in an emergency crisis, whether that's suicidal thoughts or having symptoms of psychosis, just trying to meet them at their need in that moment of time.
When you look at your team and Mental Health Co-op overall, let's kind of back up a little bit. Mm-hmm. ADHD, anxiety, there's a lot that you all do. So talk about the team, the specialization overall, and then we'll dive back into your world.
Mm-hmm. So the Mental Health Co-op, just to give you a good picture of it, is like you could consider it to be a Walmart. Essentially, like, you're talking about, you have anxiety, ADHD, major depression. There's a slew of diagnoses out there, and we want to be able to reach and address every single one of them, if you have those or not. So we can meet you at that level and continue to move forward with you.
When you look at what that means then for your team in terms of expertise and training, give us an overview of the team.
For my team, we have a range of experience from bachelor level positions all the way through MDs. So for my team, we have a lot of master level clinicians. They have gone through school to obtain their master's degree and have post-credentialing up to 3 years for licensure as well.
So how has the pandemic, because when you look at the pandemic going through it, opening up the conversation around mental health, and then going through too, you see things like the suicide rates, unfortunately, rising, and the anxiety and depression and all of these things that we are starting to really talk about at a deeper level. What have you all seen on your end, both during the pandemic and obviously now coming out of it, especially with your area of focus?
Yeah, the pandemic was awful, especially for suicide rates. Just not having that interpersonal connection between folks, I felt really just damaged a lot of folks, and just they didn't know how to reach out and get that assistance that they needed. Coming out of the pandemic and now into this world, like you said, like mental health is a very big thing that we're all talking about now. So I think it's important that we spread awareness and let everyone know that we're here to help and that there is some service out there for someone.
Obviously, on your end, as you mentioned, when you talk about psychiatric care and those that are thinking about committing suicide, very critical in terms of the timing to be able to get the help. How does it work on your end in terms of the interface for referrals, for people reaching out? So in other words, where does it start on your end?
Sure. So our department is a 24-hour, 7-day-a-week department. Anyone can call. Anyone can walk in at any time, 24/7, and they're going to start to immediately get care as soon as they walk through the door. It could come from a loved one. It could come from yourself. It could come from a community partner like the police or a firefighter, an emergency room. So we want to make sure that, we send out as much as information that we have so anyone can obtain the services they need at any given time.
Walk us through kind of what the intake looks like on your end in terms of sitting down with someone who is in a critical state, and is it question Q&A? Like, walk us through some of it. And obviously it's going to be different with individuals, but in general, give us an idea of kind of what that looks like with the interface.
Sure. So our team has a multidisciplinary approach. So whenever you walk into our office, you'll meet with a receptionist, and check in like much like you would at a doctor's office. At that point in time, you would then be met with a nurse. They would obtain your vitals, go through a brief medical history. And then you would be transferred over to a counselor who would then speak with you and conduct an assessment with you or an interview and just address the needs that you're address the problems that you're experiencing and how we can move on from this crisis.
Obviously, don't name any names, but
Sure.
give us an idea of some of the testimonials, the ways that you've been able to personally help. And so it can be, an individual that, is an illustration of helping to get them on the right trajectory or just in general, but give us a testimonial of success on your end.
Yeah. So here this past week, interacted with an individual who was suicidal and felt like he was at his wit's end. He stayed with us for about a week voluntarily. We continued to engage him in treatment. A lot of his stuff was also with experiencing homelessness. So we were able to connect with community partners and find him a place to go, get him back on medications, become regulated. When he was on the way out the door, he stopped me. He's like, "Hey, I just want to let you know, like, I appreciate you guys so much. If it wasn't for you, like, I'd be dead somewhere." And so I really appreciated the assistance that you guys provided me.
Yeah, that's awesome. Touch on what the individuals are dealing with, because once again, very broad in terms of, homelessness and the things that they're dealing with, but touch on, because I think when you talk about suicide, it's something that crosses all races, religions, socioeconomic levels. And so touch on kind of what you see from that vantage point.
Yeah. So, there's really no like cookie cutter experience. Everyone goes through their own, whether that's substance abuse, whether that's severe and persistent mental illness, things like bipolar disorder, schizophrenia. So anyone could ask for services on any level. And so we're just trying to encapsulate all of that.
So when you think about like tips and recommendations for family and coworkers who have friends who might be thinking about suicidal thoughts or might have, these sort of issues that you want to help with, what are some ideas or recommendations that you would offer up to those? I mean, obviously the referral to you is a big piece of that, but
Sure.
how can we be better prepared to be advocates to help others?
Mm-hmm. So the first thing I would say is ask them directly, like, are you having suicidal thoughts? What does that look like? Then on top of that, just having the courage to be there with them during that moment of time and just being vulnerable with them and just let them know that you're there to support them. I think that's huge. These are thoughts that are scary, but having someone there on your side and just going through that experience with you, or not with you, but there to be there to support you is the most important thing.
How has this work changed you personally and professionally? Because I've got to imagine when you look at, your ability to pour into others, and just like the testimonial you shared earlier, what does that mean to you? How has that transformed you?
Yeah, so I have somewhat of a lived experience. So I have family members who deal with mental illness, and so it's important for me to continue to do this work and try to affect those as much as I can. It's hard work. It's very taxing, but at the end of the day, like, if we could just save one life, it makes our day worth it, and that's all that we're here for, is just to help folks.
Talk about the ways that the community can help. I mean, education plays a vital role. Obviously, the referral and knowing you all exist and where to refer and how to refer, that's a piece of this. But touch on the different ways the community can help your efforts.
Absolutely. So last year, 988 came out. So if anyone has any questions at all, or if they're experiencing a crisis, they can call 988 and obtain those resources. They can also call us. We do have a 24-hour number that's available, and we can walk them through that process on the referral. So if you have someone, or if you yourself are experiencing a crisis, you can call us and we'll walk you through that process on how to obtain services.
When you look at where you all are going as an organization, you mentioned expansion and touching different areas of Tennessee, across the state of Tennessee. Touch on some of the different plans for the future, and it can be specific, obviously, with your department or organization wide, but give us an idea of what the future holds.
Yeah, the future. I would like to think bigger picture, like, able to treat more folks, able to welcome in more people. Ideally, in a perfect world, like we don't want to have to do that, but we are here to do that. So if we, oh man, just be able just to help anyone who can walk through the door at any given time, just have like no restrictions on like, capacity or anything like that. Like just have that open door and just let our folks in Tennessee know like, hey, we are here to help you.
Do financial contributions on kind of the nonprofit side, is that a major play in terms of being able to help lift and offer the support and open up the access? I know that you all take, different insurance and TennCare and some of those, but talk about kind of the financial structure and how the community can help on that side.
Sure. So we are a TennCare agency. We do serve folks who are uninsured through our safety net program. So we are fortunate enough to have grants through the state as well to be able to serve folks. So yeah.
Talk about where the state of mental health is right now. So if you were to put a pulse on what you're seeing, are things, getting better in terms of the conversation around mental health, and you're seeing more and more people getting help that they need? Or is it still something that we need to do a much better job of opening up the conversations? Where would you put your pulse on where we are right now around mental health?
I think we're getting a good start to it. COVID opened up a lot for us, especially on social media, to start sharing about, lived experiences and things of that nature, connecting folks to help. And coming out of that now, there's this push, whether that's from your managed care organizations or at your community partner levels of, hey, look, there is help out there. This is part of, like everyone's overall well-being is your physical health and your mental health. So I think that, we're hitting the highlights, and I think that, there's more to be expanded upon.
Touch on the 988. You've mentioned that obviously, but give, for those listeners and viewers who aren't familiar with what 988 is, give us a little background on that.
Yeah, so 988 is going to be the crisis lifeline. So this is to model the 911 number. So folks who are experiencing a crisis can call 988, much like 911, and receive real-time assistance. The idea with 988 is to potentially remove the barriers from the legal system and obtaining with the health system. So oftentimes folks are calling the police whenever they're experiencing a crisis, and oftentimes they're not well equipped to deal with individuals in the community who are experiencing a mental illness or mental health crisis. And then having that 988 number and having folks who know how to work within the system is just a better outlet.
Yeah, and I think that's an important distinction. Is it provides access to those who can really help, who are trained and equipped to help within those circumstances. And then it also too frees up so that you're not calling 911 where the emergency response on that side. So it's creating efficiencies over one side, but it's direct access to the people who can actually help on the other. So I think it's important on both sides to understand the distinction between 988 and 911. So touch on contact information and referrals, website. So when you talk about the Mental Health Cooperative, how do we start carrying these conversations forward? How do we start making referrals? How does it work? Where do we go?
Absolutely. So our website is going to be mhc-tn.org. From there, we have multiple links for where people can search for the services that they need and be recommended to the treatment immediately. Our phone number is 615-726-0125, and that is a 24-hour, 7-day-a-week number. So they can call in at any time and speak with a triage counselor or a licensed counselor and begin that process on seeking out help and how to get it.
Is it necessary for someone to call in advance, even though you're open and the conversation obviously is 24/7? Is it necessary for them to call versus just coming in?
We'll take it either which way. So ideally, like for myself, I like to know what's going on. But oftentimes we just have people show up on our doorstep, and that's totally fine too. We're happy to assist you however you want to make contact with us.
So all of that, I think, is important just for the public to know. Is you've got the easy access point physically, obviously the call ahead number, you've got 988. So many different resources. Once again, the website, mhc-tn.org. So obviously MHC, the initials for Mental Health Cooperative, mhc-tn.org for all the information. Michael, thank you for all you and your amazing team do. Thank you for coming on the show.
Thank you for having me. I really appreciate it.